Hey everyone, my name is Salim Razai. I am a ER physician in San Antonio, Texas. I had done a video about 2 weeks ago kind of telling you what it was like on the front lines of emergency medicine in the emergency departments that I work in. And um, First of all, I want to take a moment to say thank you. Thank you to everybody who's reached out to me to check on me, friends that I've not spoken to in years, people I've not seen for a long time, even people that I've never met before. I just blown away by how many people reached out and said thank you for everything that I'm doing. So I just wanted to take a minute to let you know that that is very much appreciated, and I'm so thankful for all of you. And This is what I went to school for. This is what I trained for. It's unfortunate that it's under these circumstances, but this is what I signed up for when I went to school. And so just knowing that it means so much to so many is it's a very humbling thing. So thank you so much. For those of you who have been practicing social distancing, staying home, I'm in complete awe of your sacrifices, and just know that by doing the things that you're doing, you really are helping flatten that curve and not overwhelm our health systems. And for those of you who are getting kind of stir crazy and at home and just wondering how much longer this is going to last, that's the $1 million question. We all want to know how much longer this is going to last. And I don't think this is going to go away anytime soon. But just know from your actions, because you're not allowing the healthcare system to get overwhelmed, you are allowing us to protect ourselves with our personal protective equipment. And you are also saving lives by not letting us run out of resources like ventilators and oxygen and other medications. And so when you ask yourself, how much longer is this going to last? I'm tired of doing this. Just know that you are helping society at large. This is not about any one of us. This is about all of us. So thank you so much for everything that you're doing. So today I wanted to go over 3 more things that I think are rather confusing, actually. They're confusing for me as a physician who reads about this stuff all the time, and I can only imagine how confusing it is based on what the news is putting out. And what we really need is some well-done randomized clinical trials, and there are over 300 of them that are underway, but these things take time, and they're important because we want to make sure that we get this right. We don't want to do things that are going to hurt people, but it's very confusing when you get all this political hype and you get certain unnamed presidents coming on TV and telling you that this is the cure for a particular disease process. So the first one we're going to cover today is about people who have hypertension. This question's been running around quite a bit about if you're taking a medication that's called an ACE inhibitor or an angiotensin receptor blocker, ARBs, should you come off these medications? Because there's been lots of reports that it's killing people. And so I wanted to take a minute to try and answer that question. So I think before I can answer that question, there's a couple of things I want to kind of get out of the way. So the first thing is that SARS-CoV-2 is the name of the virus, and the illness that it causes is called COVID-19. So I see these two terms kind of getting used back and forth, but I just wanted to clarify that. And the reason this is important is because the theory is that SARS-CoV-2 causes infection by binding to a receptor called ACE2. Now, ACE2 is found all over the body, but it also happens to be found in the lungs. And there's a theory going around that people who take ACE inhibitors and ARBs, that there is this upregulation of this ACE2 receptor, and maybe that translates into worsening infection. So what I can tell you is that the data in humans is very limited. There's not enough evidence to tell us whether this is true or if it's false, if this actually does hurt people or if it doesn't. And it gets even more confusing when you look back at some of the animal studies, because there's some that show that this could be harmful, but then there's others that show that, well, maybe these medications could be protective. None of the big governing organizations like the European Society of Cardiology, the American Heart Association, the American College of Cardiology, none of them at this time are recommending for people to stop these medications. So although the reality is we don't really know if stopping these medications will help or hurt, the one thing that is true is that by stopping these medications or by changing to a different type of medication, blood pressure now becomes uncontrolled and can become very labile. And the one thing that is fact, that is known, is that uncontrolled blood pressure can lead to things like strokes. And so comparing not knowing to what we do know, the current recommendations are continue taking these medications. Rest assured, there is research underway. And when we have those answers, those recommendations will get updated and we will start telling people that it's probably a good idea to come off or to continue taking those medications. So I just wanted to kind of clear that up because there's been a lot of stuff that's been going around, lots of people asking me, and so I wanted to answer that question. So the second question I'm going to try and discuss is, if I take ibuprofen and I have COVID-19, will this kill me? So this all started by a tweet out of France from the French healthcare prime minister, I believe, is where that came from. And he wrote something to the effect of that people taking ibuprofen seem to get sicker and that it's killing people. And so then everyone took this to mean that they should not be taking ibuprofen, and now you can't even find Tylenol or acetaminophen anywhere because that's all anybody is buying. This is very much like the ACE inhibitor and ARBs question, where there's another biologic plausibility that ibuprofen increases the ACE2 receptor, which is, if you remember, where the virus binds to cause its infectivity. So there's a few things I want to say about that can maybe help kind of clear up the water and what I'm recommending to people. The first thing is that the observations coming out of France were based on a handful of patients that were very sick and they were already on ventilators and had pretty bad disease in terms of their COVID-19. And what we don't know is that were the patients already so sick that whether we used ibuprofen or we didn't use ibuprofen, they were going to succumb to the illness? Or is it really that it was the ibuprofen that was making them worse? And it's kind of a chicken or egg type of thing. I think that what we can say is that they noticed an association, but they certainly cannot make the statement that ibuprofen is the cause. The second thing I wanted to say is that in order to prove something is causing worsened outcomes, you would need a much, much larger study where you have enough bad outcomes that you can actually say that something is causing it. So certainly a handful of patients who got sick is a cause for concern, but there's no causation that we can associate with that. So my recommendation right now is that if you're having fevers, you're having pain, you're having body aches, Tylenol, acetaminophen should be your number one medication that you use. But if for some reason that's not working, it doesn't mean you cannot use ibuprofen. And as a matter of fact, I tell people that if acetaminophen is not working, feel free to use ibuprofen. And then finally, if my words do not ring true, the World Health Organization has also put out a statement stating that they do not recommend against the use of ibuprofen. So this is not just me, some random ER doctor telling you this. This is actually supported by the World Health Organization as well. So the third question I'm going to try and answer is the statements by Donald Trump that hydroxychloroquine and azithromycin in combination are the cure for COVID-19. The short answer here is no, that is not true at this time. So what I would say is this is so hard. We needed a treatment 4 months ago, and we're still waiting for these trials. And then you get all this media and political hype that says that something is actually true. And in times of crisis, through no ill will, people tend to grasp for straws. And so I want to talk about those straws for a little bit. So the first thing is when we grasp for straws, we're making a very big assumption, and that assumption is that whatever it is that we're grasping for is going to cause benefit. But the reality is that there can also be some very real harms, and we need to consider those harms. And I want to go through some of those with you before we start saying this is the miracle cure. So we do have some early studies that are rather small and I would say not very well done, but it's the best or earliest evidence that we have at this time that show that hydroxychloroquine and azithromycin probably do help reduce viral loads. The bigger question, though, is does reducing a viral load translate into something that we all care about, which is life? And does that mean that it's saving lives? And I don't think we have enough information to give us that answer at this time. So the combination of hydroxychloroquine and azithromycin is not a benign combination of medications. Both medications in combination and by themselves can cause prolongation of an interval we see on the EKG called the QT interval. And prolongation of the QT interval can cause some very fatal arrhythmias. And we're now starting to see more and more cases being reported of people just dropping dead from arrhythmias. And it's probably because, one, we don't know what the right dose is. Number two is we don't know how long you should take it. And so if we don't know these things, then we're basically experimenting at this point and with a very real harm that can come from the medication. The second harm I want to kind of bring up is there's another viral illness that has a funny name called chikungunya. I just like saying the name. It's a funny illness that can happen. It's another viral illness, and in lab tests, it showed that hydroxychloroquine actually reduced the viral load. And then when we started using it on humans, what we found is more people got even more sick when they took the medication, and several died from taking the medication. And so we have to be careful looking at these early studies that tell us that viral loads are reduced, because we have no idea how that's going to translate to us as humans, as people. The final thing I would say is that when we start using medications like this for something that's unproven and we don't know whether it works or not, there's lots of people in the world that have other illnesses like lupus or rheumatoid arthritis who need these medications to keep those illnesses under control. And when we start hoarding these medications and start using things that are unproven, those medications start to run out. And it's not fair to those people who've done absolutely nothing wrong to not be able to get those medications simply because we're just following the media hype and what our president is telling us. So I think those are the main reasons why this is not the miracle cure. Well, that's all I have for you guys for this episode. I appreciate, again, everybody reaching out and the questions people are asking me. I'm writing these down, and when they start to recurrently come up, I'm going to try and record these little short videos trying to answer those questions, just to kind of save me some time, and then also maybe give you something that is archived that you can come back to if somebody else asks you those questions, so you guys can share factual information. So keep the questions coming. As always, stay safe, keep up the social distancing, and wash your hands a lot. It's really important. It took a pandemic for us to realize how important that is, but keep it up. And thank you for listening. And hopefully I'll be able to get another one of these out to you guys soon. Thank you so much.